So, you have a lot of pain in your hip. You've been told your hip is bone on bone and you need a new one. Well, you know, total hip surgeries have been around for a long time and most of them do really well, but sometimes things go awry. Well, how can you tell if it's going to be easy, or more difficult to save your hip? And the primary thing is not pain, the primary thing is range of motion. When you lose cartilage in a hip, the first thing you lose is the ability to internally rotate the joint when it is flexed 90 degrees. Flexion of 90 degrees is what you do when you sit in a chair. Internal rotation is moving this way. So you're going to find that as the hip joint wears out, you can get 90 degrees, but you can't internally rotate. If you can internally rotate one of your hips way more than the other, the one that doesn't do so well is the one that's in more trouble. Well, the better your preserved range of motion, the easier it is to save your hip. One other thing to look at that helps give you an idea that this could be a lot more difficult, look at the x-ray. If the ball of your hip joint is still round and isn't flattened on the top, you have a much better chance of saving the joint. We've still been able to save them with it a little bit flattened, but it does make it more difficult and does make the process more of a project. Well, if you're interested in avoiding total joint surgery and you'd like to try and see if you can save your hip, those ideas will help you decide, and then give us a call. Look us up, www.blatmanhealthandwellness.com. Have a wonderful day.